For everyone joining in, thank you for joining us. This is going to be a presentation on the Twin City Hospital Workers Pension Plan as sort of a prelude to contract negotiations as the techs at Abbott and St. Francis consider putting forward a proposal to improve your retirement plans. So I'm excited. My name is Jamie Gully. I serve as the president of our union. I'm also chair of the pension plan. I'm pretty passionate about pension plans and retirement plans for workers, and am excited to kind of review with you the difference between the 401k retirement plans that folks have as compared to a pension plan, and then to dive into the specifics of the Twin City Hospital Workers Pension Plan next. We're going to save time for as many questions as you have. We're going to record this so that you can come back to it later if you'd like. But we do want to make sure that we answer as many questions as we can about pension benefits. All right, so as we get started here, does anybody on the call have a pension plan already through another employer, or if you were part of the old Alina pension plan? What was called a money purchase pension plan. Does anybody know? Or is pension plans brand new for everybody?
Brand new.
Brand new? All right. So we're gonna talk a little bit about the difference in philosophy between a pension plan and a 401k plan. So first, when you are thinking about retirement and how you're gonna live life and things during retirement, one of the key principles that we like to share as a union is that our goal for all of our members in retirement is that you have as much money as you had working. Now, the working wage that you had at your retirement is usually going to be a little bit higher than your income in retirement itself. And for a lot of folks, that's okay. The reason for that is because expenses oftentimes go down a little bit in retirement. For many members, they own their home, so there's not a mortgage. You still have the taxes to pay on it and the upkeep of the home, but the mortgage is hopefully resolved by the time you reach retirement. There are less commuting expenses and uniform expenses and things related to getting to and from work that are able to help folks. So for a person in retirement, if you are making 70%, if you have 70% income through Social Security, a pension plan, 401k, and other incomes, you're usually about to live the same quality of life that you had while you were working. So our goal for our members is for everybody to get at least 70% of your working wage at retirement to maintain quality of life. Obviously, if you're a renter or if you have other life differences from that sort of average member experience, things might be a little bit different in your circumstances, but 70% is the goal for members to have between Social Security and pension and 401k and things like that. Traditionally, a retirement was made up of three sources of income. That was Social Security, pension plan, and then savings. Often in a 401k or 403b type plan. Many members also save in IRAs or just in bank accounts through their own savings plans. But we call that a three-legged stool of retirement. There should be three sources of income in your retirement. For members who don't have a pension plan and you just have Social Security and savings, that is a little bit of an unbalanced type of retirement. It's becoming more common than it used to be back in my parents' generation. Pretty much everybody had all three. They had a pension plan, Social Security, and some savings. But as we move in and we see what retirement is looking like more recently, a lot of seniors are retiring with just Social Security and their individual savings. As a result, we see more and more people experiencing poverty in retirement or a decline in their living standards. And instead of a pension plan, what we see is a lot more people working part-time and sort of extending their working life in order to make ends meet in retirement. So that's not ideal. It's not what we want to see somebody be forced to do. If you want to do that, that's fine. But being forced to work in retirement is not ideal. That is not our hope for our members. So 70% between Social Security and pension, and then individual savings as well. One of the things to just think about when you're budgeting for, like, okay, how do I know if I can retire? When you have a Social Security and savings only model, does anybody know, how do you figure out when you can retire? There, you have to make some guesses on this. And Debbie, any thoughts on like what kind of factors go into play on like, okay, when can I retire if I don't have a pension plan?
Well, I'm past retirement age and I'm working part-time, so
You're still working part-time.
yeah. I thought that you should be able to take out, it's like 4% of your retirement a
Yeah.
year, and be able to live on what you have.
Yeah, if you live on sort of your retirement investments and you take out 4 to 5% a year, that will usually last you from your principal balance there. So, but for a lot of people, it really depends because the stock market can go up and down, and what 4 to 5% might change from year to year. The hardest thing to figure out when you're on a 401k type program is the big unknown is how long are you going to live, right? So the with a pension plan, you get a check every month for as long as you live. So you don't need to know how long you're going to live. You know that you will have that source of income, just like Social Security, for as long as you live, and that's true for the Twin City Hospital Workers Pension Plan as well. So think about these types of retirement vehicles. A 401k is in many respects like a loaf of bread. And when you're retiring, you have to figure out like how long am I going to live? How many slices of bread can I have? You have a certain amount, and it can get slightly bigger, slightly less based on the stock market. But you really have a fixed amount of money that you have to dole out and portion out for the rest of your life for as long as you live. And that can be a lot of guesswork. It's hard to know. It is not give you the same feeling of security that you might have or might want with respect to a pension plan. Now, a pension plan, unlike being a loaf of bread that you have to figure out how to portion out over your entire retirement career, you should think about the pension plan as a well of water. It is something that you come back to every month and you get a check for as long as you live. So it's not designed to be sort of an opportunity for you to go to Las Vegas and gamble it all, at one fell swoop, kind of wild living style. Some people do that with their 401ks. You really can't do that with a pension plan. Your pension plan is going to be a monthly check, just like Social Security, and it is there as replacement income for you for as long as you live. And the big difference between the two really is related to risk and security, and the styles of these things. So with a 401k, we call it a defined contribution plan. So how much, most years, how much Alina or your employer is going to contribute to your 401k. Sometimes they don't, as we experienced during the pandemic. But for the most part, you kind of know what the contribution is going to be going into your 401k account. But you don't really know how much you're going to have when you retire because the stock market goes up, it goes down. It depends on your investment choices. And a lot of people aren't very savvy. They don't really like to think about these things. It's in many respects, it can feel like gambling. But some people really like it, and I don't want to minimize the fact that some people really like to invest their money. They take it very seriously. Some people are good at it. Some people are not great at it. It just a lot depends on chance and your tolerance of risk. So I'm just gonna show you sort of like a little. This is gonna be reversed, I think, here on the screen. But I usually do these in person, and I'm gonna have to. It's not gonna work with my background here. So let me get rid of my background filter. All right. So a 401k, what is defined is the amount of money going into your account that then goes into the stock market, and what you get out is unknown. So all of the risk is on you as the individual who is retiring. The risk is entirely on you. You could come out really great, you could come out really terrible. And if it is terrible, unfortunately, as a senior, you don't have a lot of choices. You know, you're either going back to work, relying on family, or having a significantly lower standard of living than what you had hoped. A pension plan is not, the contribution isn't what's defined in a pension plan. It's the benefit that's defined. So in a pension plan, you have a guaranteed monthly benefit based on what that is. And so if the stock market goes down, the employer has to put in more money to the pension fund in order to fund your benefit, so that they have to make sure that you get the benefit that you're owed. And so the risk on this is on the employer or on the pension trust, and not on you as an individual. You have to get the money. And in the most pension plans, including ours, we're federally insured. So we have insurance to make sure that you get the benefits that you're owed. And that is through the PBGC, the Pension Benefit Guaranty Corporation, insures the pension funds that we're part of. So I hope that makes sense. This is just sort of an overview of sort of our goal is to get you 70% income and to treat it like income, Social Security and pension, monthly checks. And then we also advocate for savings. You should have a 401k. You should continue to advocate for a matching program in your benefits, so that you get the employer to contribute to your 401k as well. But we want to make sure that you get 70% of your replacement income in retirement. And that is something that we have been able to achieve for the last 50 years for members who have 20 plus years of employment at Allina that are part of the union pension plan. So I'm going to share on the screen a booklet that will also be available to all of you to review sort of in person, but I'm just going to share it so that we can talk through a little bit about the specifics of the Twin City Hospital Workers Pension Plan. Before we jump in though, does anybody have any questions just sort of about retirement and sort of the difference in a 401k and a pension plan with respect to how you get the benefits in retirement? Okay. If you do, feel free to loop back on this and just let me know. Sorry about this. Let me stop sharing and reshare because I lost my booklet. All right, here we go. It is not working correctly. 1 second. Okay. The Twin City Hospital Workers Pension Plan is the oldest pension plan for hospital workers in the country. This predates M&A's pension plan. It was established with a win by our union in an interest arbitration in 1965. And the first pension checks were issued a year later to workers at Mount Sinai, which then became Phillips Eye Institute and is now part of Abbott. But the pension plan is called the Twin City Hospital Workers Pension Plan, and it is one that provides for, as we said, guaranteed income, monthly income throughout retirement. One thing to note, if you bargain into the Twin City Hospital Workers Pension Plan, everything you have already earned in your 401k and 403b and even the old money purchase pension plan in Allina, nothing happens to that money. That money is all there. It's already been contributed to you, so there's no change to any of those provisions. All of that is the same. So this would be for moving forward. You would be able to direct some of your retirement money into the pension plan so that you can accrue benefits in the union pension plan. Do you need to contribute anything to a pension plan to be eligible? The answer is no. So under our proposals and under the law, only employers can contribute to a union pension plan, and that's done through negotiations. But all of the contributions come from the employer. You can't personally choose to put more money in from your own check. It has to be what's negotiated for the employer contribution. So no employee contributions are permitted into the union pension plan. vesting requirements. So does anybody know what Debbie, do you know what vesting requirements are? What does the word vesting mean?
How long you have to be part of the plan in order to get out of it?
Great, yes, that's how long do you have to be employed in order to receive a benefit? And in this pension plan, the vesting rule is 5 years, but all of your prior years at a line account. So even if you were not part of the pension plan, all of your years count as vesting years. So Debbie, you would have what, 30 plus vesting years on day one if you join the
Yep,
pension?
yep,
So
yep,
you would have more than 30 vesting years. So anybody who
yep.
has 5 years or more is going to come in and automatically be vested. And what that means is even if you only worked like half a year, you would be entitled to a pension benefit. That benefit will only be based on how long you're in the benefit for the pension fund. So if you're only in 1 year, you would get 1 year of benefit, but your vesting service would guarantee that you do get the benefit. You don't have to wait 5 more years if you already have 5 years with the employer. And I would say pre-retirement, there are some benefits that are based on vesting years rather than benefit years. So Debbie, like if you continued working part-time and experienced, unfortunately, a pre-retirement death, or anybody did, your estate or your kids or your dependents would receive a benefit that's about all of your vesting years. So they would receive 30 years worth of benefits under that benefit program rather than just the one. So that vesting number really counts for a lot of things, not just for being entitled to a benefit in retirement. So if you negotiate into the pension plan, then moving forward, each year of service, you get a benefit year. And under this pension plan, you get the benefits are you get full benefit basically at a 0.6. So on the 401k plan, you only get contributions based on what you earn. So a 0.6 is about half as much of a benefit as you would get if you were a 0.6 in the pension plan. So the pension plan gives full benefits at a 0.6. Does that make sense? So we give you benefit, you get the whole amount even though you worked fewer hours. And here's sort of the grid for how many hours you have to work in order to get some benefit. So you get, even if you were a 0.4 here at 870 hours in a year, you would still get a benefit multiplier of 0.6. So a little over 6/10 of a full year's worth of benefit credit. 1,400 hours, that's a 0.6 plus 2 shifts gets you a full benefit credit. So there are a couple of reasons that the pension benefit is better, and when you add it up and you calculated it over your years of service, why does the pension end up delivering a better benefit than the 401k to folks? One of the reasons is because of this, because we don't reduce your benefit based on your FTE in the same way that the 401k does. So your 401k is completely prorated. This one gives you full benefits at a 0.6. Another reason the pension is better is based on that vesting rule and what we call forfeitures. So if somebody started today and they left 3 years from now and they didn't get 5 years worth of service, they would forfeit their benefit. They would not get a benefit. And in that circumstance, they might have been better off in the 401k. But who gets the benefits? The money that was contributed goes to everybody else who does stay. So anybody who leaves with less than 5 years of service, they leave, and the money that was contributed on their behalf goes to the rest of the members who do stay. And we have about 15 to 20% of members do terminate within less than 5 years. And that money then gets distributed to everybody else. That's another way that your benefits are higher and greater as a result of being in the pension plan. A third way that pension plans generally produce better benefits is related to fees. So Debbie, I don't know on your 401k which investments you're in, but they have a lot of fees on individual accounts because you're in a small account and it's just not as big. With the pension plan, you're in with about $500 million worth of funds. And so we're able to negotiate way better fees for the professional management services. And that returns back to the members, 0.5%, 1% a year, compounded year over year over year. And that really, really adds up over a lifetime. And then the final way that the pension fund also helps to produce a better return in retirement is because in an individual account, generally speaking, people get more conservative in their investment strategy the closer they get to retirement. And if you're in a target date retirement funds like the Freedom Funds for Fidelity, it automatically starts making your investments more conservative as you get closer to age 65, age 66. And the pension fund, because not everybody retires at the same date, is able to stay tilted fairly aggressively for all years. And without risk to you, the risk is on the plan, not on you as an individual. So even in a down year, there's no change in the benefits to our retirees or to what you're promised. And so that tilt towards the aggressiveness also adds to the ability for the pension plan to add value to members in retirement. And we're going to talk a little bit and show some comparisons about how much better it is to be in the pension as compared to the 401k with the same amount of money going into each. And we're going to do that here shortly. But I just want to make sure folks understand how it is that the pension with the same amount of money from your employer can deliver a better benefit to you as a worker. Does that make sense? The forfeitures, the tilt on the aggressiveness without having to get conservative, the lower fees and professional management services all really do add to greater returns. All right, so let's do a couple of benefits. And one thing I would just add is that the benefit just went up in the pension plan. So it's now $33 a month instead of $32. So this is just slightly out of date. That happened a few months ago. But we'll go through a couple of examples so that you can kind of see how things compare. So let's suppose you retired, under this example, I'm just going to use 32 because that's what's in the sheets and I don't want to confuse folks, but just know that the benefit has increased since then. If you retired on January 10th of 2020 and you had 10 years of vesting credit, but only 1 year of benefits. So Debbie, let's say this is you, and in the last contract you got the pension plan, but you retired after 1 year. You're going to get a check of $32 a month for the rest of your life. Okay, that doesn't sound like a lot, but if you compare it to what you would get from the 401k plan, it is actually going to be significantly better for you. So that's one example. So if you had 1 year of benefits, it'd be $32 check so you would get about $400 a year for an average lifespan of 20 some years. So you're talking about 400 times 20, being $8,000 in total benefits for an average member's lifespan, compared to the 401k, which would be about $1,500 total for that contribution. So it delivers significantly better. Now, if you were 28 years, let's say you retired that same time, but you had 28 years in the pension plan, your monthly benefit would be $896. Now slightly higher than that, but that would be near a significantly higher check as a result of more years in the plan. That's just sort of how you calculate the benefits. You do have choices when you retire. You can make it based on your partner's, your lifespan. So it goes as long as you live. You can get a slightly reduced amount to make it based on like your partner. So with you and your partner, it would go until both of you pass away. Because that's 2 lifespans, then there's a slight reduction in it. But you get to make those choices when you retire. Again, anything that you already have in your 401k, 401(b) plans, nothing changes with those. And you can still contribute. So here's the other benefit of the pension plan. If you transferred from one of our facilities to one of the others, you could continue, your pension can go with you. So the pension can go to Unity Hospital for radiology and others. And if we get Abbott and St. Francis in it, it will make it even more portable so that you can transfer within the Alina system and get the pension benefit and have no gap or change in your benefit. All right, so we're going to go through a couple of examples and we're just going to show you what the difference is between the current non-contract version of benefits at Alina versus if you had the Unity Hospital pension and 401k combined benefits. So in the first example, if you started at 25 and you made 25 an hour, and now you're retiring at age 65, the total value of the pension plan will be about 730,000. Or sorry, defined contribution. Your 401k, including compound interest, and we assume a 7% return every year, would be 730,000. That's how much you would have in your 401k. In the member benefit program, if you had the pension plus the 401k contributions under Alina, the total value of the plan is a little over $1 million between the benefits for an average lifespan. So you can kind of see the difference is about 25%, 30% greater pension benefit with the pension and 401k combined versus just being in the 401k. Now you would think if I'm closer to retirement, maybe this wouldn't be as good of a benefit for me. I just stick with what I have and continue in that route. But actually the reverse is true. The closer you are to retirement, the better the difference is for the pension benefit. And the reason for that is if you're in the 401k for a really long time, compound interest really, really helps you in your as you get closer to your retirement. But the pension fund, because you don't have as much time to get compound interest, the closer you are to retirement, you just kind of get the contribution. You don't get the compounding effect. So the closer you are to retirement, the pension delivers way better value. So if you're 5 years from retirement, 10 years from retirement, you're going to get way, way better returns being in the pension fund at that point in your career than if you were in the pension fund even the whole time. So you're going to see this here as we go forward. So case number 2, if you started at age 45 and you only had 20 years in the retirement programs, the total benefit that you could expect from your 401k is only 136,000. And that's because you didn't have another 20 years worth of compound interest in the stock market. But the pension fund and union benefit that we do combined at 219,000 is almost double the retirement income that you get for being in the pension fund. So if you're age 45 or later, you're going to almost double the benefit that you can receive in retirement by being part of the pension fund. And for all of the reasons that we described earlier about why we're able to get better returns from the pension. Let's do another example for part-timers. So if you're a part-timer and your benefit gets prorated because you're not working full-time, you'll see the value of the pension plan even go up further. So over a 40-year career, if you're in the 401k for that entire time at a 0.6, your total projected value at 65 is $438,000 in your 401k. Whereas if you were in the pension plan, which gives full credit at a 0.6, your total retirement as a member would be, again, double what the non-contract version is at 882,000 in retirement benefits. I'm going to do one that's even closer to retirement because I know that we have some senior people who are more senior members, are the most focused on retirement. So I wanted to make sure I got one that's a little bit closer to retirement here. So if you're age 55 and you're working part-time, a 0.6, the total projected value would be 81,000, and it would be triple that for the pension plan at 222,000. So again, just trying to make sure that we show comparisons here for folks on how much better the pension is. There are 2 caveats to this. There are 2 examples where somebody would be better in the 401k, and I like to be transparent about this so that you can consider your specific circumstances, even though we know for the majority, the pension plan would be better. So 1, if you work less than 5 years at Alina and you plan to move to Seattle or Las Vegas or somewhere else, and you don't plan to stay for 5 years, in that case, you would be better off in the 401k because you're going to get at least some benefit that you get to take with you. And if you were in the pension plan the pension benefit stuff would be distributed to everybody else who does stay, rather than going to you. So in that case, yes, you would be better off in the current version. The other example is if you leave Alina like 20 years prior to 65. So like if you worked there from age 25 to age 45 and then left, you would have been better off in the 401k because you would get another 20 years worth of compounding in the stock market. And in that case, the benefit would add up to be better than what would be more year gain. Not be the case because you're not getting any benefit accruals in the pension plan. So I'm including here some of the assumptions on this, so you can kind of understand how we did the comparisons. I did these comparisons with Alina, folks from the Alina Treasury Department. So these are the same numbers that Alina would know. Contribution to your non-contract version, it's the same amount of money as the pension plan 401k combined. So in this, it does not cost Alina any money to do this. It really is cost neutral. It is how a majority of our members to be in the pension. That have risk is on them, on you, with respect to if they're really market or something like that where they need to add more pension plan to pay the benefit guarantees. That is a circumstance that Alina would prefer to avoid having that risk and liability. But for the most part, our plan is a fully funded plan. It's never been below 100% funded. So we could right now today pay every single member every benefit that they're owed. It's on among the more conservative plans, and it's federally insured. So we think that risk is very, very low, but it is there. And that's just by design that the risk would be on the employer instead of on you as an individual. So that's the crux of the opposition from Alina, is that they prefer not to have that risk. But I'll stop and pause to see if there's any questions from folks on pension plans in general, on this specific pension plan, or just like how does the pension get such a better comparison to a 401k only style retirement. All right, did it make sense, Debbie? I know you got a chance to spend a little bit of time with us last contract when we were pushing for this. So this might be a little review for you, but how did I do this time? Did it make sense?
It does make sense. Yeah. Yeah. I guess, people just have to think in their heart, do they want to spend their career at Alina?
Yeah. It definitely rewards you for staying versus leaving. Any other questions? I sure appreciate everyone for joining, and appreciate you for letting us record this so that we can share it with others. I want to make sure that everybody is as educated as possible on this. We'll also have the handbooks that I kind of walked through there with the examples that you can sort of share. I know Connie will be picking some up for the Abbott members, but copies of it will be available through Sange and Crystal as well. Happy to do more questions. Anybody can email me or call me. I really am passionate about the pension plan and retirement for folks. We absolutely want to see our members able to have a great retirement, retire on a beach if you can. We want you to have a great standard of life and quality of living, that you don't feel like you have to come back to work. It's your chance to enjoy yourself, to for many members, to have money for gifts for kids and grandkids and some trips and things of that sort. We want to make sure that you have a good quality of life and a good standard of living. And we do not want to see members retire after a long career in healthcare and then experience hardships of poverty and declining standards of living that we know. The average 401k balance of our members is not nearly enough to last a retirement that's 20 years plus. So we really, really do appreciate the members who came before us that built this pension plan for us, and that is there for us to continue and to help expand and to make it available to healthcare workers in the future. So, all right, if there's no other questions, again, I'm going to put in the chat my contact information. We'll make sure that the pamphlets are available to everyone. I appreciate you for joining us, and feel free to follow up with any additional questions or thoughts in the days ahead.